Assalamu alaikum. My name is Dr. Abdul Wahab, Associate Professor, Department of Pharmacy, Quat University of Science and Technology. I am course instructor for the subject dispensing pharmacy, and our today topic is therapeutic incompatibility. So we will be discussing about the therapeutic incompatibility. So as you can see over here in discussion outline. So prescription incompatibility, first of all, we will describe or define prescription incompatibility. Then classification of incompatibility and pharmaceutical incompatibility and therapeutic incompatibility. So first of all, we will be discussing about the incompatibility. As you know that we have already studied in our previous lectures about the incompatibility, but our today main topic is therapeutic incompatibility. So before going to discuss therapeutic incompatibility, I would like to define again incompatibility. It may be defined as it is the result of mixing two or more antagonistic substances. And is detected by change in physical, chemical and therapeutic qualities. Physical, chemical and therapeutic qualities of what? Of drug. Or we can also define therapeutic incompatibility. The prescription incompatibility may be defined as the interaction between two or more components of a prescription to produce physical, chemical and therapeutic changes in the preparation. So if a doctor prescribe any medicine or any prescription, so if there are different drugs in the prescriptions, so there are possibility of physical, chemical and therapeutic changes. It may affect the safety, efficacy and appearance of the medicine, and so pharmacist must use his knowledge of chemistry and pharmacology to detect and then to prevent such type of incompatibility. As we can say that due to incompatibility, the efficacy, safety and appearance of the preparation of the dosage form or of the drug can be changed. So if a pharmacist is having knowledge of chemistry and pharmacology, then he or she can easily detect the different types of incompatibility. So classification. Generally, incompatibility are classified on the basis of different types of reactions, which actually lead to unwanted effects. There are two main types of incompatibility: pharmaceutical incompatibility and therapeutic incompatibility. As we have already studied about the pharmaceutical incompatibility in our previous lectures, like physical incompatibility and chemical incompatibility. As you know that physical incompatibility is further divided into three types, like insolubility, immiscibility and liquefaction. Similarly, chemical incompatibility is also divided into different types, and today our main discussion agenda is, or I can say the main topics for our today discussion is therapeutic incompatibility. So therapeutic incompatibility, it is undesirable interaction between two or more ingredients which leads to potentiation of therapy, destruction of efficacy of one or more of the ingredients, or occurrence of the toxic effects. Therapeutic incompatibility exists when the response of one or more drug in the patient is of different nature or intensity than that intended by prescriber. Understand? Therapeutic incompatibility exists when the response of one or more drugs in the patient is of different nature or intensity than that intended by the prescriber. The therapeutic incompatibilities resulted from errors on writing or interpreting the prescription order. It may occur due to one of the following reasons, like dosage error, wrong dosage form or drug, contraindicated drugs, synergistic effects, antagonistic effect, drug-drug interaction, drug-food interactions. So first of all, we are going to discuss the dosage error. If therapeutic incompatibility is due to dosage error, as you can see, the overdose or underdose of the medication is the most important and serious type of dosage error, which lead to therapeutic incompatibility. It can result from the administration of excessive single dose or the too frequent administrations of usual doses or missing of doses. It is important the pharmacist must check such error as it is found oftenly in case of children. So it is the responsibility of pharmacist, of you people. Being a pharmacist, it is your responsibility to check such errors. It is mostly found in case of children. So as you can see over here in this graph, it is plasma concentration and it is time. For example, as you can see in this graph, so it is conventional dosage form and containing multiple dosing. So it is the subtherapeutic level, as you can see, subtherapeutic level, and it is therapeutic level. It is minimum effective concentration. M is the minimum effective concentration, and the level between the and it is a maximum safe concentration. The level between minimum and safe is therapeutic level, and over here you can see the toxic level. Above the maximum safe concentration, if the drug reaches in the plasma above this level, so the drug will there will be result of toxicity or side effects. So these are the different areas. So on the basis of this area, we can easily interpret the dosage error. For example, as you can see over here in this graph, if doctor prescribes a tablet of capsule of 500 mg TID, thus in die means 3 times a day with duration of 6 hours. For example, as you can see over here, it is a first dose, so the drug will be absorbed and the concentration will be increased gradually. So after reaching the peak level, the concentration will be declined gradually due to elimination or excretion of the drug. So the next dose, as if the doctor prescribes with the duration of 6 hours 500 mg, so the next dose should be given after 6 hours before going the concentration of the drug toward the subtherapeutic level. The second dose should be given to maintain the plasma drug concentration. So if uh, if he or she means the patient takes a second dose of tablet or capsules after 4 hours instead of 6 hours, then toxicity will occur because the concentration in plasma will increase. But if he or she takes after 8 hours, after 8 hours, as you can see over here, then drug will be eliminated or excreted, and concentration of drug will be decreased, and it will be declined below subtherapeutic level, below subtherapeutic level, and no beneficial effect will be shown. So to avoid such type incompatibility, the pharmacist should advise the patient properly to show compliance. If there is incompliance, if the patient does not obey the instruction of the doctor, so therapeutic incompatibility will be resulted. So to avoid such type of incompatibility, it is the responsibility of the pharmacist to counsel the patient, to advise the patient for the compliance, that the patient must obey the instruction of the doctor. Otherwise, therapeutic incompatibility will be resulted. Example of dosage errors. Atropine sulfate, as you can see over here, it is the prescription, and the quantity of atropine sulfate is 0.006 gram. Similarly, phenobarbital 0.015 gram, aspirin 0.3 gram. Dispense 10 capsules. It is a prescription order for the pharmacist. So in this case, the quantities of phenobarbital and aspirin represent a reasonable single dose. However, the quantity of atropine sulfate is high as compared to recommended dosage. So this leads to the therapeutic incompatibility. Prevention. Pharmacists should contact the prescriber to clarify the matter. If there is ambiguity in the prescription, so it is the responsibility of the pharmacist to contact the prescriber to clarify the matter. But how can we detect the ambiguity? If pharmacist is capable, if pharmacist is having knowledge about the incompatibility, then he or she can identify the incompatibility. Otherwise, it is not possible to identify the incompatibility. So background knowledge of pharmacology, of pharmaceutical sciences, is must, that a pharmacist should have a command on the different subjects like pharmacology, pharmaceutical science. Contraindicated drugs. Sometimes therapeutic incompatibility results due to contraindicated drugs. The use of certain drugs may be contraindicated in particular diseases or in situation where an individual has previously shown an allergic response to it. For example, adrenaline is contraindicated in patients having an acute peptic ulcer. Having an acute peptic ulcer. So we can say that if a patient is suffering from acute peptic ulcer, then adrenaline should not be prescribed. Phenylbutazone is contraindicated in jaundice. Similarly, iron and calcium is contraindicated to the kidney patients. Sugar is contraindicated to diabetic patient. Prevention. How can we prevent such type of incompatibility due to contraindicated drugs? Pharmacists should contact the prescriber to clarify the matter. Similarly, a wrong dosage form. There are many drugs having names similar to the other drugs but totally different in nature, which are sound alike and look alike, such as Merex, anti-asthmatic drug, and Atorex, anti-allergic. So there is similarity in names, in sound, and look, like you can see over here, Merex and Atorex. Merex is anti-asthmatic drug and Atorex is anti-allergic drug. A pharmacist is not having knowledge about the pharmacology, so it will be very difficult for the pharmacist to identify such type of incompatibility. Similarly, Valium, it is CNS depressant drug, and Kalium, it is anticoagulant. So to avoid such type of incompatibility, background knowledge of pharmacology is must. Losec anti-ulcer and Lasix antidiuretic. So both are looking same, as you can see, and sound alike and look alike. Xanax CNS depressant and Renex anti-ulcer. Therefore, the pharmacist must be sure about these, otherwise therapeutic incompatibility will be resulted. Example, if Polyfex ointment is prescribed, then it must be considered that whether it is eye ointment or skin ointment. So incompatibility due to wrong dosage form occurs. If the prescriber writes only Betnovate tubes, it is not clear whether it is cream or ointment. So prescriber must be consulted in this regard, whether it is ointment or cream. Only Betnovate tubes is not sufficient for the clarification. So it is the responsibility of the pharmacist. It is responsibility, being a pharmacist, of you people to consult the prescriber that whether it is cream or ointment. Prevention. The pharmacist should contact the prescriber to overcome such type of incompatibility. Synergistic effect. In synergism, the combined action of two or more drugs is greater than that which would be expected from the sum of their individual actions. When one drug enhances the effect of other drugs, this is called synergism. So in synergism, the combined action of two or more drugs is greater than that which would be expected from the sum of their individual actions. Examples: alcohol, when administered with antihistamine, barbiturate, and hypnotic, which enhances the depression of CNS. Thiazide diuretics increase the rate of metabolism of anticoagulant, such as warfarin. Prevention. To prevent such type of therapeutic incompatibility, a sound knowledge of pharmaceutical sciences is required, because sometimes the prescribed do so intentionally. Antagonistic effect. When one drug blocks the effect of another drug, then it is called antagonistic effect. This opposing effect is the basis for the use of antidotes. Example: antacids may delay the absorption of phenobarbital. Antacid decrease the absorption of aspirin. Diazepam and caffeine, when administered together, they cancel the effects of each other because caffeine is CNS stimulant Well, diazepam is seen as depressant. Drug interaction. This term is applied to those situations in which the effects of one drug are altered by prior or concurrent administration of another drug. Drug-drug interaction and drug-food interaction. Example, penicillin prolongs the action of probenicide. Castor oil decreases the absorption of fat-soluble vitamins. Tetracycline combines with the metal ions in GIT are present in the milk to form complexes that are poorly absorbed. Prevention. This type of incompatibility can be prevented by the ability of the pharmacist to detect such interactions and to contact the prescriber in this regard. Mechanism of therapeutic incompatibility. Mechanism of therapeutic incompatibility. They are divided into two groups, like pharmacokinetics. One drug affects the absorption, distribution, metabolism, and excretion of another drug. Pharmacodynamics. One drug affects the pharmacological activity of another drug. For example, synergism, antagonism, as we studied in our previous slides. Pharmacokinetic interactions. Altered GIT absorption. Altered pH. The non-ionized form of drug is more lipid soluble and more readily absorbed from GIT than the ionized form. Example, antacid decreases pH and lowers absorption of acidic drugs. For example, ketoconazole. So we can say we should not prescribe, the doctor should not prescribe ketoconazole with antacids because it will decrease absorption of ketoconazole. Therefore, the drug must be separated by at least 2 hours in the time of administration of both. Contact the prescriber in this regard. Altered intestinal bacterial flora. Certain drugs' activity is influenced by normal intestinal bacterial flora, which in turn is affected by antibiotic administration. Example, 40% or more of the administered dose of digoxin is metabolized by the intestinal flora. Therefore, antibiotic cause high concentration of digoxin by killing these bacteria. Similarly, complexation. Example, tetracycline forms complexes with calcium and iron containing preparation. Similarly, antacid, aluminum and magnesium hydroxide, chelates, ciprofloxacins and decrease its absorption by 85%. Drug-induced mucosal damage. Example, anti-cancer drug, vincristine, cyclophosphamide inhibit absorption of certain other drugs, for example, digoxin. Altered mobility. Example, metoclopramide, antiemetic, delays stomach emptying and increase absorption of certain other drugs, for example, cyclosporine. So we cannot administer these 2 drugs concurrently, metoclopramide and cyclosporine. Altered protein binding means distribution. Certain high affinity drugs displace other plasma protein bound drugs and thereby increases its concentration. For example, phenytoin 90% bond and warfarin 99% are displaced by aspirin and sulfonamides. Altered metabolism. Majority of drugs are metabolized by CYP450 family. Certain drugs either induce or inhibit these enzymes and thereby affecting the metabolism of co-prescribed drug substrates. Enzyme induction. Example, phenytoin increases hepatic metabolism of theophylline, leading to its decreased level and reduced action. Enzyme inhibition. Example, verapamil inhibits carbamazepine and metabolism and increases its concentration. Omeprazole inhibits oxidative metabolism of diazepam. Altered renal excretion. Inhibition of renal tubular secretion. When a drug has a computative reactivity to the protein that is responsible for active transport of another drug, this will reduce such a drug excretion, increasing its concentration and hence its toxicity. Example, probenecid decreases tubular secretion of methotrexate. Methotrexate. So if there is a decreased tubular secretions, then there will be increased concentrations in the body. Alteration of urine pH. Ionized drugs are reabsorbed lower than non-ionized ones, making the pH of urine acidic, and will make weakly basic drugs ionized and hence enhance their excretion. These are useful in some clinical situations, such as poisoning treatment. For example, amphetamine poisoning can be reversed by enhancing its excretion via urine acidification. So thank you so much. It was all about the therapeutic incompatibility. We will be discussing our coming lectures all about the different extemporaneous mixtures. So thank you. See you again.